One.
Hi, my name is Gurjot Kaur, student ID A00127348. I'm a student nurse looking after 47 years old Caucasian Anglo-Australian female. She is admitted to Royal Adelaide Hospital for elective total abdominal hysterectomy with bilateral sepicectomy with ovaries preserved. Sarah is on operating list today for her abdominal surgery due to large symptomatic uterine fibroids. She presents with severe menorrhagia, chronic pelvic pain, pelvic pressure, and iron deficiency anemia. Her preoperative observations are stable, and Sarah has history of chronic iron deficiency anemia secondary to heavy menstruation bleeding, essential hypertension, surgical history of appendectomy at the age of 12 with no complication, and she takes ferrograde C daily and perindopril 5 mg in the morning daily. There's no significant family history of gynecological cancers. She is a non-smoker and consumes alcohol occasionally. On assessment, her vital signs were stable. Oxygen saturation is normal on room air. Blood pressure is mildly elevated and is being monitored. Sarah's primary issue include chronic pelvic pain as reported by patient herself. She describes it as a constant lower abdominal heaviness and back pain affecting her daily work. Also objective findings including abdominal guarding and mildly elevated baseline blood pressure, consistent with ongoing pain with numerical pain score of 4 out of 10. Psychological assessment indicates preoperative anxiety related to upcoming major surgery, as evidenced by verbalized fear of anesthesia and postoperative pain, along with restlessness. She is also anxious about returning back to life, to her work. Additional risks include VTE risk due to increased BMI and expected postoperative immobility, surgical site infection risk related to iron deficiency anemia affecting tissue oxygenation, and increased adipose tissue at incision site. Recommendations are to continue preoperative monitoring, particularly the blood pressure, administering prescribed preoperative analgesia on time, applying the TED stockings, preoperative before the transfer for VT prophylaxis, administering IV prophylactic antibiotic as prescribed before incision, and providing ongoing reassurance and anxiety support, and involving the family as she has got full support from her husband and 2 children. Ensuring consent documentation and preoperative checklist are fully completed before transfer to the theatre. Thank you.